Hello again. We are back and we are still discussing blood donation. Save blood, saves lives. So we talked about ensuring the safety of the blood and all that. We talked about, in fact, Dr. Anne mentioned something that really struck me. She said a pint of blood saves 3 lives. You can imagine 3 lives. So if you're donating, you are saving 3 lives. But let me not get carried away. It has been a very interesting conversation. So I'd like to continue in that light. I'd like to ask Dr. Anne, please, to avoid blood transfusion complications. How can a doctor ensure that a recipient gets a safe blood? As in what are the potential complications that can arise when the blood is unsafe for the recipient?
Okay, so I will start by saying the clinician himself must know that blood cannot always absolutely be devoid of complications, and therefore should only prescribe blood donation when it is necessary.
Okay.
So the indications must be obvious, because there are many complications that come in from blood transfusion. Some are predictable and we can avoid, like the transfusion-transmissible. Some we cannot predict, like a patient that has an acute febrile reaction. So there are complications that are related with blood transfusion. So the very first step is that the indication must be necessary. No unnecessary blood transfusion. Having said that, when the blood has been requested for, the bank has to ensure that the blood is well cross-matched, well grouped, make sure that what we're giving is compatible. The recipient donor is compatible, that there are no unexpected antibodies, that the cross-match has been well done, and there's no transcription error. Because most of the blood transfusion reactions we see, you say, what is transcription error? You have done blood group O, you are about to write it in the book, you are talking, and you jumped line 1, and the next one is A, and you placed A on the bag. That's transcription error. So you did not it was not that you wrongly cross-grouped or cross-matched. That rarely happens. But if you don't concentrate on your move, that's why the world has gone digital and these things just paste them. But here that we are still doing the manual, we need to be very careful. Then when the blood bank has ensured that you have the appropriate blood and it comes back to the clinician, they must always confirm that that blood belongs to that patient. So you just don't collect and give. You collect and you take the blood and you are taking the patient's requisition and saying, AA, blood number this, blood number this. Those are and then you don't start blood transfusion and go away. The clinician should be at least 15 minutes or 30 minutes, depending, at the side of the patient, monitoring the patient to see if there are the most dangerous complications will occur very early in transfusion, or let me say the most life-threatening ones will occur very early. I won't bore us with the extent of transfusion reactions, but when there is a mismatch, that means you took a different blood group to another one, it could cost the patient his or her own life. And so we are extremely cautious about that in the blood bank.
Okay. Dr. Shikomaya, do you have anything you want to add?
Well, I really do not have any more to add.
She has done
justice to it. She has done justice to it, yes. But I think I should mention that when she's talking about the clinician, she's not mentioning the doctors alone. The doctors make the prescription, but the nurses are usually available to monitor the patient. There's this rule of thumb you've taught us when we're doing residency. You monitor the patients every 5 minutes in the first 15 minutes, every 15 minutes in the next 30 minutes, every 30 minutes till the end of transfusion. So those rule of thumbs, I always encourage people to follow it. As I said, the worst of it, the most deadly of it happens in the first 15 minutes. You will know. The patients will complain of some signs. Even within the first 5 minutes, I can feel its sensations going in me. As the blood is flowing in, I can feel its sensations. I can feel pain at my back. Like a particular case, when I came to your office, we were talking about a particular case. The female was having abdominal pains. And we were like, oh, why is she having abdominal pains? She was actually having pains coming from her kidneys. And it wasn't picked up fast, early enough, because they really did not understand. But they were able to pick up the complaints, but nobody understood the relationship between. It was not actually, the patient was expressing those pains as an abdominal pain.
Understand? Because it comes from within that area.
So there are things like that. So the patient will always try to communicate with the patient. No matter how sick the patient is during blood transfusion, once the patient can say anything, I hope you're fine. hope nothing is happening to you. I hope your body's not itching you and you're checking the temperature. Is there anything you want to tell me? Once the patient is why are you quiet? So it's always good to communicate with the patient during those first few minutes, because the patient itself, him or herself, might not even know what to expect. So you need to communicate.
Oh,
And I think that reminds us that blood transfusions should be done in the hospital with registered health personnel.
Yes,
very important.
Very, very important. Yes.
Emphasis on
Yes, really, because anything can happen.
Yes, I couldn't agree more. So, Dr. Anne, I'm about to shake the table. You know, when I mean shaking the table, I'm talking about paid blood donations.
Paid blood donations.
And I know your stand already, but for the sake of our listeners and our audience, let's just reinforce or make it emphasize. Sorry. So let me ask. We know the World Health Organization requires that blood donations should be voluntary. Are there provisions for paid donors?
I will say, answering that question directly, absolutely no. And I will say what I'm telling you, absolutely no.
So people want to also.
I said so.
Yes.
Because it is not only a risk to the recipient, it's a risk to the person donating. People think, I've donated, I'll get it back. And you're donating every month. The body does not have enough time to replace that donation. Before you know it, you're sick yourself and you need donation yourself. That is one. So the health risk to that person is there. But also the health risk to the whole blood system that we have in the blood bank is also there, because a paid donor will not tell us the truth. We've said that, and I will not want to beat it again.
He's
going to hide the risk factors, hide so many things that we need to know. In fact, the fact that we can find out if his blood is low because we test him before, but except he goes to unregistered centers and they bleed him, he can collapse. But he's also a risk to the whole inventory, because if he is in the latent period, for instance, because he had played around or did some high-risk behavior, and we give that blood. Remember, we're giving 3 people. 1 pint saves 3 people. Oh. So we're not putting 1 person at risk.
3. So
you can see.
So for those of us that want to be hustling and be paid, please, money is not the goal. Humanity is the goal, please. So thank you very much. Do you have anything to add, Dr.?
Well, I can't but talk about the recent emergency that happened in Lagos State, where we had the collision between the train and the bus. A lot of blood was needed. First of all, I will thank the voluntary donors, because the first set of blood we got all our own negatives out and sent it to the to Lassots, to the facility where they were first taken to. Before people started donating blood, we had blood on ground. And that is why I must say that many, many people's lives were saved, because they didn't need to look for blood. They were just wheeled off to the theater for surgeries. So I really, really want to thank those voluntary donors that donated in the past, that had already had their blood screened and kept in the blood bank refrigerator. And much more, I want to thank the people that came in to donate to fill up the blood banks. Because once you use blood, somebody needs to fill up the blood banks. We had over 500 people coming to donate blood in 1 week. Even when we said we had enough blood, we were like, we need to donate blood. Please let us donate blood. And many people's lives were saved. People that were not involved in the accidents but needed blood. People that on a good day, they would have had one form of mortality. Even if they didn't die, they would not have complications because they didn't have blood at the right times. Their lives were saved. I really, really do want to encourage everybody out there that please give blood, people. Voluntarily, just come in, give us that blood, smile. Like a friend of ours will say, if you don't give the blood, the mosquito will suck it. Please don't let the mosquito suck the blood.
Trust me, Nigerian mosquitoes.
They really will suck the blood. Just come in and give the blood voluntarily.
That's good.
Oh, wow.
That's a nice one.
Yes.
Okay.
So I would also, in this light, so are there other advantages of being a blood donor?
Well,
apart from the fact that you're saving lives.
Yes. First, you're saving
lives. I know there are some
for
people too that I know of a certain man then that used to ask me, where can I donate blood? My PCV is always high. It's always high.
Yes. So the first thing I tell people is that if you donate blood, you have an automatic free health check. You get your blood pressure checked, you get your weight looked at, you do some preliminary tests, your temperature. Some people are going about with low-grade fever that they did not know. And then you get to be asked a lot of questions. I always have this success story about this particular donor that came in. He's a regular donor, but he came in on that day and was looking very tired. And the donor counselor said, "You're looking tired, mister." He said, "I've been swimming all night. I was not able to sleep." And the next question she asked was that, "For how long has it gone on?" Because this is not a one-night tiredness. On the long found out that person was actually a patient that had diabetes mellitus. And so you are opportune to talk to not doctors all the time. We are talking to healthcare personnel, and they might be able to find out some medical conditions. So it's like you're walking in to have a free health check, to have a free doctors or healthcare workers counseling session, and that's always very nice. Apart from that, you have an opportunity to mix with other blood donors and the social part, you make friends. The mental part, there are studies that shows that regular blood donors have no mental issues, especially in Lagos, that the traffic, the generator fumes, the noise everywhere is able to, and the stress at work and the time you spend on the road can give you some mental health conditions. It has that studies that shows that regular blood donors do not have mental issues. And that's because once you give blood, there's always this joy because you are saving lives. If you are doing something, you're happy to do it. So it helps to improve your mental state. And as I said, because you have an opportunity to talk to healthcare workers, conditions like anemia, you can have treatment for it. Like at the blood transfusion service, once you do not have adequate, if you are unable to donate blood because of a low hemoglobin level, we give imatinib. So you have free treatment too. If it is too much, we ensure that you are referred to the doctors. Even if you are positive for those TTIs, we ensure that there is a referral. We make sure that I get to the hospital. We encourage you to go. We encourage them to also bring back the response. Some people do not want to bring back their response, but we always give a referral to see the gastroenterologist if it's hepatitis positive, if it is HIV positive, dermatologist, or HIV clinic, we refer you there. If you have polycythemia, to the hematologist. So there is always an advantage, all sorts of
something you would
advantages.
stand to
And then
gain.
you have a free drink too. Just for you have
That's the part.
you have t-shirts sometimes. You have gifts.
This
So
is the one I'm coming
souvenirs.
from. I've donated before. Don't look at me like that.
So there are so many things.
I believe you've actually done justice to this particular question. I'm not going to, unless you
I
have
think
something
I would want to add because we are also in the academia and researches are showing that it improves reduces cardiovascular risk. I know there was a study that was done, is it in Dutch or somewhere, I'm not too sure, among women, 160,000 women who had donated for 10 years. And they found that those who had been donated regularly for 10 years had less cardiovascular risk. And another study was done on just blood pressure. And they took donors who were hypertensive and those who were not hypertensive, who had donated for a year. And when they compared their blood pressure, they actually found that among those that were hypertensive, some had to reduce their dose of hypertensive. A few had to stop their antihypertensive. And the conclusion of that study was that it could also help, though there were observational studies in reducing. So it has that. And then generally, studies have also shown that the overall health, it might be the mental area or the fact that iron is being lost, less lipid, so many things is improved in those who donate. So there is
also the cancer risks. Yes,
there's a reduced cancer risk.
There's reduced cancer risks. So if you donate regularly, you have a reduced cancer risk.
Some people even say weight, but we don't have enough evidence to support that weight. We don't have. Some studies have said it, but the evidence are not so strong for us to say that. But it's good mentioning.
Oh, wow. Very informative. Like the cancer risk part, I had no idea. Oh, that's really interesting. So we are gradually coming to an end, but I would like to ask each and every one of us. So I'll start with Sarah. Sarah, where can we find any blood bank around for people that require, not just the ones in your facility, aside you? Yes. And are there any blood donation awareness campaign in place, just as we are doing to their sites this podcast?
Okay.
So firstly, where
can we find blood banks? Okay, so in I think in Lagos State, I'm not sure if it's just applying to Lagos State, but I know there's the FMA. So they are the Health Facility Monitoring Agency, right? So I know they have a list on their site for is it registered and approved blood bank services? So you can check their site for all of those things as well. I'm not sure if BTS has a list of those approved facilities
So
on
the
their
BTS,
site.
we register all the blood banks.
Okay.
So once we register,
So
we
Yeah,
give them the
the-
yes,
yes,
and then
like
we
us
give it
go
to
ahead.
FMA so that
Okay.
FMA can
they're
yes.
the-
So we
Yes,
register,
they
we
start
register,
with
we
them.
monitor,
Mhm.
we regulate all blood banks, and we are quick to also close them down if need be
Yes.
in the States. However, apart from the registered is private, we have the 28 hospitals that have the blood banks. Then we have the tertiary hospital that's Lasut, and then in the federal we have Lutz there. We have National Hospital, Igbobi. We have the military hospital, police hospital, the one at Falom has a blood bank. We have the naval hospitals, most secondary, in short, all the secondary healthcare facilities, be it in the states or in the public, in the private, have blood banks. So we have big hospitals like Evercare, they have registered blood banks. Reddington, we have Duchess, they all have their blood banks, and some of them collect blood too. So really, the secondary healthcare facilities, secondary hospitals, the big ones, I usually encourage because they also have a high blood usage.
Yes.
They encourage to have their blood banks and to collect too. Yes, I want to
Yeah,
say something
listed
about
everything.
blood and donation awareness. I
Yeah,
said we are
okay.
not.
Yeah, that's
yes,
true, yeah.
awareness is quite poor in Africa, not just in Nigeria. I don't talk about Africa because there are some countries that have done a good job on their donor awareness. And so in Lagos State, in last year we started having the January advocacy month. We tried to just talk about blood, go out. This year we're at 2 markets to talk to them about donating blood. That's at Oshodi and at Ikeja. We wanted to go to the grassroots to talk about blood. At the blood transfusion service, go to secondary schools. We have something called Operation Educate Senior Secondary School Students. It has been going on since 2019. We want to talk to them so that once they leave secondary school, they can join a club called Club 25. Club 25 is a group that you join at the age of 18 and you donate blood 25 times before you are 25 years old. So we have a lot of groups like that. So we go to the secondary school students to talk to them. We depend a lot on our NGOs and small groups to talk about blood too, because we are unable to do it. I told somebody that the advocacy unit of the Lagos State Blood Transfusion Service has just about 5 people. How can 5 people talk about blood everywhere? So we do a lot of partnerships. We, for example, not just Lagos State, but I know that Lutz also does, for example, trauma care. We work with trauma care. They have a team that will talk about blood everywhere on their social media handles. They're talking about blood. We also work with trauma care. So we are doing our best to do a little bit more. It is not enough. I'm hoping that we'll have a program that maybe a weekly or a monthly program that people can come over to talk about their experiences and we can portray to the public about blood donation. And the reason why I said television programs is because I was on radio one day and somebody called it and said, it's not possible. Nobody donates blood like that. I'm like, for real? You need to see. But that is because that person has not seen active blood donation coming up. So people don't want to listen alone. They also want to see that there's actually blood coming out of somebody's veins and that blood is processed the right way for transfusion.
And if
Thank
I
you
must
very
add,
much.
we're saying it before we started,
Yes.
our social influencers should come.
They should please, if you are listening,
Because
please.
the youths hear and they do what they do.
Yes.
So I imagine if all these influencers that they look onto just put a clip once a week about being a blood donor, we will not have enough room.
Yes,
to collect.
that's what happened during the emergency period at the blood transfusion Twitter, and I don't think we ever had more than maybe 1,000 views. We had 287,000 views.
Wow,
I wanted
that's
to
big.
wow.
Yeah.
Why? Because we had social media influencers just retweeting.
Yes,
And
about that accident and
yes,
about
just
the need for
retweeting. If
blood.
only this can be done routinely, we won't be going out. We won't even have time. We won't even listen to the paid donors. Because they're not interested. They're not interested in them. People will come out voluntarily. And so if you've donated, please come back and donate blood.
Yes.
Yes.
Please do. And also radios, have the jingles every time.
Yes.
Newspapers have everyone should just join because it's a community effort.
Community effort.
So every hands have to be on deck so that we have voluntary blood donors.
Yes.
So it's not just about the physical walk on the road.
No.
You can go to the social media and
Yes.
please
Yes.
come and donate. There are a lot and a lot of advantages of being a blood donor. So sadly, we have come to the end of this beautiful session. You are not happy. Me neither. It has been very informative and I didn't want it to end. But I mean, we have to go. But we've heard a lot. The one that will still take home till tomorrow is a pint of blood saves 3 lives.
3 lives.
That is very deep.
Yeah.
It saves 3 lives. So if you are interested in donating or receiving blood, you can, listen to what we have said, and you can do your own little research around you. There are blood banks everywhere as they have listed. You can also go and donate. You can encourage other people to donate as well. Please, when you do that, you're saving 3 lives. I'd like to thank Dr. Oshikomaya. I'd like to thank Dr. Anne and Sarah for being here and for honoring our invitation. Please don't forget to like, subscribe, and follow us on YouTube and Spotify. My name is Uche Amadi, and I'm signing out.